Biunno.
Florida's very first case of the Omicron variant of COVID-19 has been confirmed to be right here in the Tampa Bay area at James A. Haley Veterans Hospital. The patient, said to be experiencing mild symptoms, had recently returned from international travel. We're live with an infectious diseases expert to break down what you need to know and answer your questions live. Hey there, everybody. Biunno here with you live on WFLA Now. Grateful to be joined here by Dr. John Greene. Dr. Greene, you and I spoke via email last week. I said to be on standby because it was just a matter of time before we had a Omicron case in Florida. We didn't know where it was going to be. Jacksonville, Miami, Orlando, Pensacola. No, the first one confirmed by of course, the VA hospital here in the Tampa Bay area, James A. Haley VA hospital, of course, being in Tampa. First and foremost, your reaction, not unexpected, is this news?
That's correct, JB. So the reality is that we knew Omicron was going to be in Florida. It was just a matter of time. And fortunately, the hospital's current technology is able to detect this virus. And there's some subtleties to how that test shows up positive that it may give you a clue that it is the actual Omicron variant. And if you are astute and send it off for the official genotype analysis, which they did, they were able to be the first to confirm it in our state. So great kudos to the James A. Haley for getting that actually proven and reported.
Again, live here with Dr. Greene for a live Q&A on WFLA Now. I already see some of the comments that are coming in. Here's how this works. For those of you who've been with us here before on WFLA Now, you see the hashtags on your screen in the yellow stripes. You see them right here beneath my name, and on the other side of the screen underneath Dr. Greene's name, you can use hashtag HeyJB or hashtag Dr. Greene. If you use one of those hashtags, we can pluck your comment out of Facebook Live, out of YouTube Live, or off of Twitter to ask to Dr. Greene here. I already see that some of the comments coming in are political in nature. We are not going to be taking any questions that are political in nature. We're going to keep it focused on the medical aspect of this, the scientific aspect of Omicron, and answering those questions here with Dr. Greene, again, an infectious diseases expert at Moffitt here in the Tampa Bay area. We just had a first one come in. And we're going to get to this one from Christina, hashtag HeyJB. I think you were just touching on this, Dr. Greene. And Dr. Greene, you should be able to see the comments flash on your screen here as well from our commenters. Christina asking, hashtag HeyJB, how do they know that it is, in fact, the variant?
So hospitals don't typically have the capability with their normal laboratories to prove beyond a shadow of a doubt it's Omicron, but we have resources in the state where we can send it to a special lab and they can quickly test it, run the genes and the printout of what kind of changes have occurred, and they know exactly which ones Omicron are versus the other variants, Delta, Alpha, and they were able to pinpoint this, confirm it beyond a shadow of a doubt.
How about this next one that just came in moments ago, and grateful to all the commenters joining us. We're going to try to get to as many of your hashtag HeyJB, hashtag Dr. Greene comments as possible. Randy, but really asking a very pertinent question. We want to keep it very real with our audience when it comes to Omicron, because we've talked about Delta at great length. We talked about, of course, the original strain of COVID-19 when the pandemic first broke out and, in the first quarter 2020. But Randy here asking hashtag HeyJB, it has already proven mild. Why the panic? And first and foremost, before I get your answer to this comment from Randy, Dr. Greene, panic? I think that there might be some panic, but we're going to try to keep it really honest and open with our audience here. Is there reason in your estimation for any form of panic? And is this, as Randy is saying, proven mild?
Well, I wouldn't say this is need for panic by any means, even if the person was severely ill, because the vast majority of people will have a mild illness. The younger you are, the milder the illness. The older you are, the potential severe illness. And if you have other comorbid illnesses, diabetes, heart disease, you may have a more severe illness. But if you were vaccinated and got the booster, there's still a sense that you would be protected against a severe illness, a hospitalization, a ventilator, or even death. So there is still great optimism that if you have very high, strong antibody levels, which occur after the booster of 3 doses or 2 with J&J, you would have a very robust immune response, even if you were older, even if you were immune suppressed. And if you do get sick, we can still give you a monoclonal antibody, which gives you an immune response against the virus. However, the concern is that it may not be as effective as it was against Delta. However, there is no proof that it is totally ineffective. So yes, we are concerned about it. No, we are not panicked about it.
Randy, thanks for your comment. Got a bunch more. Dr. Greene, with your permission, because we want to air some of this interview on WFLA News Channel 8 tonight, or of course, our NBC station. Would it be okay to record the interview?
Certainly.
All right, let's do that.
This meeting is being recorded.
And now everyone knows we're recording the interview here on Zoom. Should have done that at the beginning of the interview. Welcome to live streaming, folks, where you see a little bit of what goes on behind the scenes. You were talking a little bit about vaccinations there, Dr. Greene, a moment ago. Catherine Smith-Duguay, I believe it's pronounced, #KJB. Do we know if the patient was vaxxed? I'm going to read this email that just came in from WFLA's Nico Clemens in contact with hospital representatives. The best tool, I'm going to read this. It says, the best tool we have to ensure the public's continued health is the COVID-19 vaccination, including COVID-19 boosters, available now at all of our Tampa VA locations. But I don't see any notes here in this notice as to whether or not the patient was vaccinated. Can you speak to just whether or not the COVID-19, what we know scientifically at this time, whether or not it would have made a difference? Again, let's break this down for our audience. The hospital saying that the patient is experiencing mild symptoms and had recently returned from international travel. So, Dr. Greene, is it possible that this patient, this unidentified patient at Tampa VA here in the Tampa Bay area, is it possible that they were vaccinated, traveled internationally, and acquired the Omicron variant?
Right. So we know that up to 75% of the population has been vaccinated. So the probability is this person was vaccinated, but there's still a 25% chance they're not vaccinated. And we don't know the exact age of the person that I know of, but the younger you are, the milder your illness, whether you were vaccinated or not. So if you are vaccinated with 2 doses, you still have some protection, but if you did get the booster, it magnifies the level of immune response up to 20-fold. And the higher the immune response, the greater the protection you have against serious illness. So if you have been booster dosed, you should be very confident. If you come in contact with Omicron, the chances are you would weather this quite well.
Want to let you know, folks, that we do have a response from Governor Ron DeSantis. He responded to a question by WFLA's Brittany Muller at a press conference in Oldsmar a short time ago this afternoon. He was speaking when the news originally broke, reportedly that Omicron was here in the Tampa Bay area, and Brittany asked that question to Governor DeSantis. He gave about I think it's a 4, 5, maybe 6-minute response to the question. We're not going to play it back here because Dr. Greene's time is precious. We want to ask as many of your questions, but here's just a brief snippet of what Governor Ron DeSantis had to say in response to Brittany Muller's question at the press conference just a moment ago in Oldsmar.
Health is going to have something, but they believe that they have identified. I'm not sure where it is, but I said this last week. Once you identify it a few places around the world, it is spread, okay? So you're going to see it, and just because you haven't identified it somewhere does not mean it's not there. But the question is, when Omicron, you started to see stuff in the press about it, and people were trying to whip things up, you saw the markets drop. And the question was why did the markets drop? And it wasn't because the markets were fearful of Omicron. It was because the markets were fearful that governments would do destructive things in response to
And then Governor DeSantis goes much more into nationally the impact of what Omicron is doing economically to or reports of Omicron are doing economically to our country. If you want to listen to the full explanation there by Governor Ron DeSantis, we have it for you right now on WFLA.com and the WFLA app. But back to the questions that are coming in. I do love our commenters and the questions that we get from our commenters. Again, if you're just joining us, use hashtag HeyJB, hashtag HeyDrGreene, because I say that I love them because we get questions like this. Is a great, phenomenal question from Leah, Dr. Greene, and it says, hashtag HeyJB, if the symptoms of the patient are mild, why would they be at the hospital? This is a great question.
Right, so that's a great question. So typically, if you have mild symptoms, we don't admit you to the hospital. We give you a monoclonal antibody injection that lasts about 3 hours, and then you go home with mild illness. So why the person is in the hospital, if they actually are, that's a great question, because we typically admit patients with moderate to severe symptoms. And if you are even a very immune suppressed patient, we don't necessarily admit you for observation. So I'm not sure the patient was actually admitted and is still in the hospital, or are they actually at home and it was detected there? But that is a great question.
How about the next one that's coming in? And we've got a bunch. Leah, thanks for yours. That was one that I was wondering too. If the symptoms are mild, being at the hospital and getting a COVID-19 test, that's very interesting. Let's get to this one. And Cindy Payne asking a moment ago, hashtag JB, what are the symptoms of Omicron? Dr. Greene, can you speak to this from our commenter here, Cindy?
Yeah, so the symptoms are no different than the Delta and the Alpha variant. So they act just like a cold or the flu: congestion, sinus pressure, a cough, sometimes some nausea, some headache. But how do you compare COVID in general against other viruses? If you lose your smell and taste, that favors the COVID-19 virus, whatever the variant is, over other viruses. And there is no symptom that is unique to the Omicron variant versus other variants. They all present similar. And there's no evidence as of now that it is a more severe illness than the Delta, but it is potentially 5 times more contagious. And we feel like it may wind up taking over as the most common variant in our United States and in Florida, outcompeting Delta and replacing Delta as it is done in South Africa. And all of those things are potentially expected, but they are not necessarily omens of a bad news, bad prognosis for the state or the country.
A lot of commenters joining us across multiple social media platforms, including hello to YouTube Live. We're going to take our first YouTube comment, again, with infectious diseases expert Dr. John Greene, joining us from Moffitt here in the Tampa Bay area. And let's get to P.O., his comment or her comment on YouTube, hashtag HeyJB. Do the current monoclonal antibodies still work on Omicron, Dr. Greene?
So the feeling is the current monoclonal antibodies do work on the Omicron variant, but because of the genetic mutations, there's concerns that it may not work as effectively as it did for the Delta variant. And even the company that makes monoclonal antibodies, one of which is Regeneron, even said that our monoclonal antibody may not be as effective against the Omicron as it was Delta. That doesn't mean you won't get it, but you may not have as strong of a protection with it. And then there's other monoclonal antibodies that they are hypothesizing may give you greater protection, but that's all speculation now. And they say within 1 to 2 weeks, with all these sophisticated studies at warp speed, that answer will be much more solid and firm. If we wait another week or two, then we'll have a solid answer to that question.
I think we're going to do a 2-for-1 here with Elizabeth and Bethany in our comment section. We'll start with Elizabeth. Elizabeth Lara, hashtag HeyJB. If I already had COVID and recovered, should I be worried for You know what? We'll treat these separately. I was going to do this in a 2-for-1, but we'll treat this separately. Elizabeth asking, if I already had COVID and recovered, should I be worried for Omicron?
So if you had the COVID infection, likely from the Delta variant, in the last 90 days, your immune response is strong enough that you should likely not catch the Omicron variant. If your illness was greater than 90 days, then the probability each day increases that you could be susceptible to getting it. There is wild debate that 90% of scientists feel like the vaccine immunity, even if you were infected, has greater quantity of protection in your body than the actual viral infection, and 10% of scientists are arguing the otherwise. I tend to be in the 90%. The bottom line is, yes, you're probably protected for at least 90 days, possibly longer, just like you would be if you had the booster vaccine, all the way up to that level. So that would be my answer for that question.
And so if you were one of the people, basically what you're saying is if you were one of the people that in the first few months of the pandemic here stateside, if you got COVID, you are much more likely to be vulnerable to the Omicron variant.
That is correct. And even in South Africa, the data is coming back that people who already had COVID are catching Omicron, and they had COVID a year ago, a year and a half ago, 6 months, 9 months ago. So we already know that if you're prior infected, they're getting infected at high rates in South Africa, and there's no reason why that won't happen here.
How about, as promised, Bethany's comment? Bethany Peters joining us, hashtag, hey, Dr. Greene, is natural immunity and having the antibodies sufficient as opposed to getting the vaccines? We have a lot of questions and comments coming in about natural immunity. Can you speak to this,
Yes,
Dr.
so
Greene?
that is a very strong question. And as I mentioned, 90% of scientists, including myself, believe the vaccine immunity is better, stronger, even if you were infected. So if I were infected, I would still get the vaccine all the way up to the booster. However, 10% of scientists and many people that are experts say that the natural immunity is more than strong enough, just like it is for all other infections. We don't necessarily vaccinate you right away if you've had an active infection. And so that is where we're going to leave the answer, because there is no solid yes, no, there's mostly opinion, but most tend to lean towards what I just mentioned in the 90 percentile.
Got a lot more questions coming in with Dr. John Greene joining us on WFLA Now. Again, an interactive Q&A. I have to repeat myself because we're constantly engaging a new digital audience all the time. If you're just finding us on your news feed, on Twitter, on Facebook, on YouTube, wherever you might be, use any of the hashtags on your screen, hashtag HeyJB or hashtag Dr. Greene, and we can feature your comment on WFLA Now. Let's get to this one from Jeanette that just came in. Hashtag HeyJB. What part of Tampa is this case confirmed? And I'll just start this response for you, Dr. Greene, by saying it was James A. Haley VA Hospital here in Tampa. And let me ask you this. I'll hop off of this comment from Jeanette here and ask you, what's the protocol now? We have the first Omicron variant confirmed with a patient here at a Florida hospital here in the Tampa Bay area. And now what? Because there's, of course, going to be concerns that the Omicron variant continues to spread, and we know we have this one confirmed case. So for the hospital officials, the doctors and nurses there, what is the protocol that you could share with us?
So if we have a positive COVID test, then we have the ability to send the isolate to a Florida reference lab, and within a couple days have the proof that it is the Omicron variant. Will we manage it any differently? Not at this stage right now. We would still treat you as if it was any other variant. The Tampa General Hospital has a sophisticated research lab where they're able to do it in-house and identify Omicron faster. The VA and ourselves have to rely on outside sources, as do other hospitals. So we can find out quickly if it's Omicron, but as far as taking care of you, the quality of care doesn't change, because we're going to treat you the same whether it's Omicron or not, because there is no scientific evidence to give you X versus Z, depending on which variant it is at this stage.
Thanks a lot, Jeanette, for your question. And Yeah, we'll take this one. And I can answer this question from more of a political standpoint, and Dr. Greene can answer this from more a scientific, a medical standpoint. But I do want to address this because this has come up a few times in our comment section. And Yaritza, Love Cooper, hashtag HJB, we will be going back into lockdown because of this. And I can speak again politically that the chances of Florida being locked down as a result of the spread of Omicron are extraordinarily slim based on what we have heard from Governor Ron DeSantis and based on what we saw with Delta and based on his track record with pandemic response. But do you have anything to say to Yaritza's comment here, Dr. Greene?
So I would say, speaking of our hospital as well as other hospitals, we have parameters on what the community levels are and what percent of people are infected out of 100,000 people. If you start to see 20 or more infections per 100,000, that means the level in the community is high enough. We need to be prepared to start seeing patients and our own staff members infected. And we are continually testing hundreds of people every day, even today. And when we start to see the percent positive rise above 5%, 10%, we know the community levels are high, and we are now going to be prepared to have more patients with COVID and also be prepared to have more of our employees, team members have to take time off because they could easily catch it in the community. But as far as changing anything else, our lockdown or becoming more strict, that's not going to happen in the near future. But if levels get extremely high like they were during the last outbreak, then we might do things as would other hospitals to restrict visitors and to ramp up some of our protocols, et cetera. But lockdown, I wouldn't use that term. And I can't speak to what the community is going to do and the governments in the community, but at least in the hospitals, we have a very scientific approach to handling increasing levels, whether it's Omicron, Delta, or any other variant.
This is the last call for your questions for hashtag Dr. Greene joining us on WFLA Now. You can use hashtag HJB or hashtag Dr. Greene. This is a last call across all of our social media platforms, Facebook, Twitter, YouTube. You have another, you good for another 5 minutes to let these final ones come in, Dr. Greene?
Certainly.
All right, great. I'm gonna ask the one question that I want to get in because it's something that Masa Saidi, our WFLA 8 on Your Side investigator, has been covering in the news of late. Really this week on WFLA News Channel 8. And it's, let's bring it up here on screen. We're talking about kids. And there has been concern internationally that Omicron might be sending more kids to the hospital in countries that have been impacted by Omicron, that younger kids might be more susceptible to symptoms and susceptible to Omicron itself. Do you have anything to add for our reporting on WFLA News Channel 8 as well as for our audience here live on WFLA Now?
Yeah, so we've had this discussion amongst ourselves in our physician groups, and some of our pediatrician ID infectious disease doctors have said that in South Africa, they may be admitting more kids that have mild illnesses, and therefore it looks like kids are getting sicker and more likely to be admitted. So it may not be an actual reality fact that kids are getting sicker from the Omicron than the Delta. It may be the practice of admitting people for the abundance of caution and watching them in South Africa, where that report came from. So right now, I haven't seen any more evidence that it is truly more severe in kids, but it is a concern. And there may be a logical explanation other than that it's causing a worse illness in children.
Quest, thank you for that response. We'll be able to feature that in our reporting, Dr. Greene, so thank you for that. Holly Beeson, hashtag HJB, vaccinated almost a year ago. How long does immune response last?
So if you got the Pfizer vaccine with 2 doses, you're good for about 9 months, and then it starts to wane. If you got the Moderna vaccine, which is 3 times more potent than the Pfizer, then it would likely last up to 12 months. But either if you got Pfizer or Moderna 6 months ago or longer, you should absolutely get the booster vaccine. You will then have 20 times or more higher titers and protection, and your risk of getting a severe illness will be drastically reduced. If you got the J&J vaccine, then you should get a vaccine 2 months later, which is either Moderna, Pfizer, or J&J, and that will give you an added immune boost. So yes, I would recommend you get a booster vaccine.
So let's talk about that because it's literally next up in the queue. Donovan Roos, #AJB. How many more booster shots are there going to be? Are booster shots just going to be just part of the process now going forward, Dr. Greene?
Yes, so you only get 3 booster shots. There's a subgroup who gets 4 shots who are immune suppressed to get their immune system the highest it possibly can. But there is no one right now planning on giving more than the 3 booster shots for the general public. However, there are some people saying in the upper echelon of pharmaceuticals that they will have a vaccine available against Omicron within 3 months to 6 months. And if it turns out that Omicron is causing a lot of vaccinated people to get sick, you might wind up in 3 months to 1 year getting a Omicron recalculated vaccine to give you, but all of this is speculation. And we know with the flu, it changes sometimes yearly or every few years, and we typically only vaccinate you once a year. But depending on how the levels are in the community, we'll have to figure out whether you need to get this new vaccine, and then the next variant that comes along, you'll have to do it again and again and again. And how often will that occur? We were thinking annually. Will it be more frequent? We'll wait to see.
Judy Chow, #Dr. Greene. What impact does Omicron have on a pregnant person?
So I've been consulted on a couple pregnant ladies that were infected. And it is recommended by the OBGYN Society that they were to get the monoclonal antibody, even though it wasn't necessarily studied in pregnant ladies, but it's much safer than actual infection, which is worse in pregnant ladies. And they should be vaccinated and talk to their doctors about getting vaccinated to be protected, because if you're pregnant, you are at risk of having a more severe illness.
And we'll end out on this one because I don't ever want our commenters to think that we shy away from comments when it comes to certain lines of thinking. Welcome all different lines of thinking, and we'll end on this notion from Michael, or this comment from Michael Whitfield, #AJB. The fact that the word might is being used so much when talking about Omicron, and then throws up like that shrug emoji, you know, the one I'm talking about, like shrugging the shoulders. The word might being used so much by not just members of the media, but also by experts. Is that because there's just so much unknown still with Omicron as it continues to, make its presence known internationally?
Yes, because nobody has firm data that says you will have a more severe illness with Omicron, because nobody knows that. Some speculate you could, but they did that with Delta as well. And then it is more contagious, so I don't think that is a might. So that's probably pretty solid info. Will the monoclonal antibodies work is a definite might, because we really don't know how much, if at all. And then will the vaccine cover you if you have been boosted? Everything we know about the whole science of viruses and vaccine is it probably will. So we're going to use a lot of probablys, a lot of mights, and a few times we'll say certainties, but that's the nature of this new variant.
We have a lot of comments coming in without any, again, we can only feature the comments with #AJB or #Dr. Greene, and we're done taking comments, but we had a lot of comments come in without those hashtags, Dr. Greene. People saying that all right, so it's more contagious. The symptoms, it sounds as if are milder, but is this now the flu? Is this now a seasonal illness? Is just now going to be just something that we expect on a annual or semi-annual basis, maybe several different times a year? What is the reality? I want to end out on this by asking you, for our commenters, reality-based here, what is the reality going forward? Is this just now the fabric of the reality that we live in that Omicron, and we're going to hear about more variants in the future, just like we hear about flu season and getting your yearly flu shot, so on and so forth?
Yes, so the vast majority of scientists, experts are saying that the COVID-19 is going to be with us forever. It's the new norm. We will have one variant after the other, and we will have to adapt to it. The good news is, because of the infrastructure of getting vaccinations fast enough, quick enough, getting them out there, and I think this is going to escalate scientific discovery, producing vaccines that can come out at warp speed and getting them into the public, so that I feel confident that you could potentially live to your old age without ever catching COVID-19, because you have been vaccinated and you kept up the speed with it, as opposed to everybody eventually will catch COVID. It's just a matter of time.
Interesting. Dr. John Greene joining us from Moffitt. I'd like to thank all the commenters using hashtag HeyJB, hashtag Dr. Greene. If we didn't get to your comment, we'll try perhaps the next time when we do another interactive live Q&A here on WFLA Now. Before we let you go, Dr. Greene, floor is yours. Is there anything that we missed or anything that you would like to include? Anything perhaps that wasn't, asked specifically by our commenters? The floor is yours, sir.
So I would say that you're going to continue to hear of these variants coming out every now and then, because that's the nature of viruses. They mutate, especially in somebody who can't get rid of the virus, and then it spreads rapidly, because that's what viruses do. And so I think the new norm is we get used to it, we don't dwell on it, we don't get panicked about it, and we just take whatever science gives us as far as vaccinations and keep safe, healthy, doing the things we normally do. And we feel confident that we can take care of our patients and try to keep all of them as healthy as possible, even those that are immune suppressed. So we don't want people to fear coming to hospitals because they could catch COVID. It's mostly in the community, and if you do get it, we're more than able and equipped to take care of you.
I think that we all have a heightened sense of awareness when it comes to the reality that we now live in. And for everybody watching, wherever you're watching from, it's all about just following fact. It's about following reality. It's about following good information by those that are available to us, of course, like Dr. John Greene, expert in infectious diseases at Moffitt Cancer Center. Dr. Greene, thank you so much for your time. And to all the commenters joining us here on WFLA Now, thank you so much. The very latest, we have a lot of resources for you. The latest on Omicron, the latest on what is happening, including with that one patient at James A. Haley Veterans Hospital in Tampa, that one patient that has mild symptoms after international travel. We have it all for you, all the details that you need to know, and all the resources that you need on WFLA.com and the WFLA app. Thanks so much for watching. We'll see you next time on WFLA Now.